Welcome to TRS Clips, where you'll find happiness through your own curiosity. When you're cutting up penises for a living, what more do you understand about it when you see it from the inside?
So penis has a structure and has a function. So as a surgeon, I can fix a structure. But as a function, a lot will depend upon how the healing comes, as we've been talking about. For example, I had a gentleman who, in a fit of schizophrenia, detached his penis. It was cut with a blade and thrown into a toilet. And then his brother picked it up somewhere in Kurukshetra.
Oh my God.
And called me up. I said, you open a bottle of saline from the nearest nursing home, put this into a saline, wrap it with a cold ice, and bring it to me. And he brought it, and I reimplanted that. And I'm talking about 2000, maybe 1999 or 2000.
Did it work after that?
Of course, it worked. This guy got married and has got 2 children.
Oh my God.
But when I was doing that, when I was reimplanting a penis, I wasn't sure whether it would work or not.
Okay, 1 second. I have to ask you a very base level question. As you're speaking about this, my body is in pain. Did you ever have to get past that as a young surgeon?
See, if you're talking about pain of the patient, if I'm sitting in a chair in my clinic and there's a patient sitting in front of me and he has a pain, unless I feel that pain, I cannot treat him. The only difference between him and me is that he cannot think of a solution and I can think of a solution. I'm trained to think of a solution. But to think of a solution, I need to feel the same pain sitting in my chair, whatever it may be. It may be cancer, it can be injury, it can be whatever disease. So that is my way of working. If I cannot understand or feel the pain, or I cannot treat.
How do you deal with it mentally? For yourself, for your own mind and heart? Does your mental health get affected?
Not at all.
Not at all? Ever?
Never.
Never?
It gets affected when, so I tell you, if I've operated like for this patient, I came back and I slept off. We woke up at 1 o'clock, was sitting in my drawing room thinking whether it will work or not. What else could I have done? How would the family feel if it doesn't work? And how would I feel? And tomorrow my residents, my staff, and they would feel that, look, our boss has done something which has failed. So that introspection is a constant thing. And my wife comes up and says, it's 3 o'clock, what are you doing in this drawing room? And I tell her, look, I'm just introspecting. Initially, she didn't understand, but now she knows what I'm doing. So that we have to go through. If I don't go through it, so perhaps I'm gathering enough positive energy and putting it into that penis for it to heal, or whether I am, kind of soothing myself, or thinking how next time if I am faced with such a situation, what else could have been done? And that is a perpetual path of evolution and progress in my skill.
I want to ask you about that same surgery again.
Yes.
That one where the guy cut off his own penis and threw it in the commode.
Commode, that's right.
Okay. You told the relative to put it in saline water and put it in a bag of ice.
That's right.
So it stayed fresh. It didn't rot. Parallelly, I'm assuming that guy's body was bleeding a lot from down there because there's a lot of blood vessels.
That's right. So they tied it. I told them to tie it, make a bandage, because they went to the nearest nursing home and somebody just tied it and put a bandage. We have what is called Dynaplast, which is a very stiff plaster and it has an elastic thing. So just put it and it sticks and it just holds on. So that's how he came.
What about his balls?
They were intact.
Nothing. He didn't do anything there.
No, he didn't. So he used the old style shaving blades. There are 2 edges to that blade.
Oh my God.
So he used that kind of blade.
And he would have cut it like a piece of wood. Oh God. Did you ever ask him why? What was in his head?
He was not in this state of mind to answer those, because Nobody in senses would do that. So he was under treatment for schizophrenia.
So he was basically going through some kind of a brain situation
That's right.
which was making him hallucinate or something that
He
caused
must have
him.
been angry with himself. He may have, I do not know the story, but he may have been following a girl who may have got married, so he thought this is useless. This is the simplest plausible explanation for something like this.
I think a lot of guys associate the self-belief with their penises.
That's right.
Right?
That's
I
absolutely
think men
right.
in general do.
That's right.
At some age they do, and then after a point you realize, oh, life
No,
is
no.
much more than this.
That's true. But then at that age, they have nothing else to compare.
How old was he?
He was 24, I think, at that time.
Okay. Now, as a surgeon, that guy's fully wrapped up. You get a bag of ice with his cobra inside it. How do you figure what the first step is in fixing? You give that guy anesthesia.
Of course, he's
Then?
taken in for anesthesia. We open the dressing under anesthesia, ready to clamp any vessel that bleeds or spurts, because penis is a very vascular organ. So it oozes blood. It is supposed to take a lot of blood. The blood supply is there. So the moment you open up, there will be a
Fountain.
a fountain of blood. That's right.
Literally a fountain?
It is actually.
So when he was lying down, there's like blood squirting out.
So we just hold it. We have our technique to hold it. So what we do is we have a kind of instrument. We call it an artery forceps. We keep it ready. The moment it opens, we clamp it.
It's like a plug, like...
No, it is like a clip, like a hair clip, suppose,
okay.
something like that. So you
Got it,
just
got it.
clip it.
You're talking about the hole that was left in place of the penis.
No, the individual arteries that are bleeding.
Oh my God. So you have to go in and just
hold them with each of them, then repair them.
But there's been a protocol in the world of penis surgery where these kind of situations have happened earlier, where someone's penis gets cut off.
Very rare. And there was one report from Australia where it was reported that this has been, but then later on, in those days we didn't have the computers, we didn't have those so many web internet to search, and I also moved on into more cases.
Okay, let's talk about this specifically. I'm just trying to understand your world a little bit more. So you clamp up
Yes.
all the blood vessels. Then what's the surgical protocol?
So the next is to wash that, remove all the dirt, wash it generously, because you don't want any infected material. And then we have an antibiotic solution. So or what you call a wide spectrum antibiotic solution. So there was amikacin or another ciprofloxacin solution that we made and added streptomycin. At that time, we had a lot of streptomycin with us. So we used those things, made a solution, dipped that organ there, made sure that it kills all the germs. Fortunately, this penis has a cavity which is filled with blood. That is how it gets erected. So that is all open. It is like a sponge. So it's actually like a sponge. So when you put it into that solution, it absorbs all those water, that the solution of antibiotics, and it was washed. And then slowly we stitched each artery and vein and the layers of the penis, the urethra, the urinary tube, because that is also transected through which the urine passes. So the penis has a structure like this. It has two corpora cavernosa, two bodies like this, which cause erection, and the third body houses the urethra, the passage of urine. So it is cut. It is actually 3 structures in a transverse section.
3 pipes?
You can say that. There are 2 cylinders and a small pipe called urethra, which is housed in a spongy tissue so that it can, when it erects, it has a capability of lengthening, elongating, and widening and other things.
So the surgical protocol was you basically refix the pipes.
Exactly.
That's it.
Plumbing. Pure plumbing.
Damn.
That's it. So somebody asked me, what kind of doctor are you? So I say, I'm the plumber of the trade.
Wow. Love it.
I'm a urologist. So I deal with the reservoir, I deal with the valves, I deal with the conduit.
Okay. How long was the surgery?
So that lasted 4.5 hours.
4.5 hours. To stitch up one pipe at a time, etc., etc. If the same surgery was happening in 2024, how long would it have taken?
It would have taken maybe a little shorter, because now we have the availability of microscopes. At that time I used loop, but otherwise now we have microscopes, so you have a much finer instruments, you have much finer suture material, the threads to stitch, so that makes things easier.
I've had 2 surgeries in my life. Fortunately, not on the cobra, but on my shoulders for some judo injuries. And they were pretty intense surgeries. I had to stay in hospital for like 3-4 days and all that. The surgeon comes and meets you post the surgery and just gets an update in terms of how you're feeling and all that. If the listeners have not gone through surgery, let me have a shot at describing what it's like when you are operated upon. Have you been operated upon for anything?
Yes.
Okay. So please correct me if I'm wrong and if you have another experience. But you totally know when you wake up from surgery, there's 2 things that happen. One, for me, I've had 3 surgeries totally in my life. I've hallucinated every time because of the anesthesia. You see hallucinations? Okay. Fair. I want to know about this also. The second thing is you totally know that your body has been cut open and something has happened inside. You're very conscious of that body part. You kind of feel like there's a fluid buildup inside. You're hallucinating. You do feel a little sick almost. You feel like something's wrong. You get maybe a little fever, etc. 2 questions. One, tell me about this specific guy, because there's also schizophrenia mixed in. So when he would have woken up, I don't know what would have been going on in his own head, because what if he had woken up in his normal personality and realized that his schizophrenic personality had cut off his penis? So what was that experience like talking to him? Secondly, what was your mentality? Third, was he in pain?
So I'll tell you, I'll answer all the 3 questions. The first is that my mentality, I'll tell you, was that he shouldn't cut it again. So we needed to put restrainers.
Oh
so we
my
put
God.
restrainers with the thing. The second was to give some kind of injectable and psychotropic drugs which keep him calm, because
Morphine?
this was they're different ones. So some kind of haloperidol is something which is what we used in him. Serenase is the trade name. And we also were very clear in getting a psychiatrist evaluating him immediately after he woke up. And he was fortunately, before he came to us, he had been administered something like a painkiller with a psychotropic effect. So he was calm when he came to us. And he was willing for a surgery, which was extremely rare to find. I was thinking that he would be fighting when he came, but he did not. So he submitted himself for the repair. That was the best thing that could have happened on that day. And next day morning, when I'm talking to him, and we don't broach the topic, I don't ask him, why did you do it? My job is to go and tell him only positive. I went and told him, look, you're absolutely fine. You're young again. So don't even think that something has gone wrong. You haven't done anything wrong. There was something that went wrong and I fixed it. And in all probabilities, it will work. So don't even think. And what would you like to eat? So chole bhature. So something like that. So that is the whole idea. When you are actually looking at the patient, he's into a lot of trouble. You need to distract him from feeling pain and discomfort. And the best thing that I find is you offer them what they want to eat. For example, it's a kid, we get an ice cream for him or a chocolate for him. If it's an adult, if he's a Punjabi, we tell him chole bhature. So we tell them, what do you want to eat? So that is the thing. And once you offer something to eat, so then he knows that, yes, I am at home. I've arrived.
Because that's when the body can begin healing.
That's right. Positivity is the extremely important thing. See, we started with the talk that I said that there's a power that heals. That power is driven away by negativity and is brought in by positivity. My job after the surgery, I've done my job as a car craftsman, but my job is to make sure that it heals. And the way it heals is that the person has to be absolutely positive. So I go to the room, I crack jokes, I talk about the weather, I talk about his other things, and I make him walk, and I talk about what he wants to eat.
What was he saying about this whole thing? Did he address it at all?
Yes. So before he was discharged, I told him that, look, you did something which you shouldn't have done. And I'm sure you understand that. He said, yes. And I told him, look, I've been able to fix it. God has been very kind to both of us. But make sure that you protect it, because it is your responsibility to protect it. And it is no longer yours because you have cut it and thrown it. It is my penis that I'm handing it over to you. So this is mine and I'm giving it to you to protect it. Will you do that? He said, yes. And that's how it is.
When we make a mistake professionally, my protocol is always you go back to the mistake, you understand why it's done, and you respond to the situation. I'm assuming that his mistake was that he didn't take his psychiatric medication. Therefore, he went into that,
Aggressive phase.
right? That's the mistake.
Most likely, yes.
So your call to action to him was, listen, just take care of your brain first because this might happen again. Correct? Okay. The other question that I have for you related to this same case is, the penis has a lot of nerve endings. That's why it's a sex organ in the first place. Now you can repair the pipes, you can repair the skin, etc. How do you ensure that the nerves also get repaired? Because he's cut through the nerves also. So did he even have sensation?
He did. So body is great. Nature is great. One of the best computers is the human body, or any living being on the earth, whether it's plants or animals. They've been bestowed upon by mechanisms which protect them. Life doesn't go easily, even if you try to take it off. It's very difficult. We are very tenacious. Life is very tenacious. It's not easy to go. Similarly, at that time I did not repair nerves because I didn't have the microscope or something. But the nature grows. There's something called nerve growth factor that is there. So whenever the nerve is cut, the nature brings in what is called nerve growth factors, the vascular growth VGF and NGF. And these are the growth factors which perpetuate. And he was young. He was 24.
Is this like a precursor to nerve tissue?
Yes. So it allows the nerves to grow. So the nerves will start growing here. There are nerves here. Because they're vascularized, they don't die, but the structure is there. So these nerves will come and they will find another nerve and get into it. So they'll bridge. The only problem is if something like that happens to your main switch. So when you switch on the fan, it is the light that switched on. So that can be cross connection.
Oof.
Beyond that, nothing else, which means the sensation which should be traveling to your brain as a pleasure turns into a pain.
Oh my God.
That is the only thing that we have to be worried about.
Because the nerve, instead of connecting to the same pleasure receptor, connects to a pain receptor maybe.
That's right.
Oh, so what happened in his case?
He was fine.
So nothing went wrong?
No, he had sexual activity after that. He produced 2 children.
But you've seen cases where the feeling of sex hurts a guy's penis.
Yes.
Which is exactly a situation like this where the nerve is actually joining with the pain receptor.
It is actually not post-surgical, but patients who have diabetes or diabetic neuropathies or a neuropathy for another cause.
What is neuropathy?
Neuropathy is any disease of nerves is neuropathy.
Okay.
So a disease of the nerve. So there is a nerve ending which is going into the penis and it is touching the glands, and somebody is touching the glands and a pleasurable sensation is going to go back through the nerve. But here the nerve is, under inflammation. So it takes that pleasurable sensation into pain. So patients keep complaining that there is a painful pricking sensation in the penis. And that's very usual. I see it very often, once in a fortnight in a diabetic man.
So it's something that gets created over time.
It is injury to the nerve. There is inflammation to the nerve.
Due to a diabetic body.
Diabetes.
It's important to take care of your health.
That's right.
Like it can even affect you down there.
Yes.
Imagine just overnight, one day you wake up and the same feeling that was giving you pleasure once upon a time now gives you serious pain.
That's right.
Oh my God. Next time you're thinking of having that cake, just, hey, if you enjoyed today's clip, make sure you check out all the other clips we've uploaded on this channel. You'll find a clip related to almost every single topic as long as you're willing to search for it.